Hi, this is Alicia here. So now we introduce our topic. So our topic is quality improvements in healthcare. I'm Alicia here. So let me introduce our group member. This is Ashmata, Kumar, Sakari, and Wang Fei. What's the quality improvement? Quality improvement is a combined effort in the quality commitment, customer certification, continuous improvement, and the compliance with the specification for different parties to achieve a best health outcome. The history of quality improvements, we need to talk about the history of Australia Commission on Safety and Quality in Healthcare. For 1995, there was a report showed that some adverse events during admission can be prevented, and the International on the Safety and Quality of Healthcare in Australia. In 2005, the Safety and Quality Governance reviewed and recommended the health service being reformed to enhance quality improvement. In 2006, the National Safety and Quality in Health Service Standards developed. In 2008 until 2011, during this time, the Commission was keeping developing the standards and there are 10 standards were deployed. In 2011 until 2012, the House endorses the standards and start to implement the standards into hospital and the procedure service. Until 2017, there were more than 700 hospital and the procedure service were assessed. Back to the development of Singapore quality improvements, we can see from the Singapore regulatory framework. In 1980, Quality Assurance Committee started. This is mandatory for all hospitals. There are some other national medical audit programs to improve the quality from 1999 until 2003, like clinical audit in 1999, Maryland Quality Indicator Project in 2000, medical error near miss compliance in 2002, and so on. Quality improvements is relevant to the healthcare and nursing. Here is an example that the sustainable reduction in Singapore. For the background, there are 1.3 falls over 1,000 patients per day in a tertiary hospital in 2004. But after the evidence-based healthcare measures were combined with the quality improvement strategies that address fall risks to prevent fall and mitigate injury, there are improvements show that the numbers of fall was reduced, and the results show that the sustainable fall changed into 1.09 for over 1,000 patients per day in 2008 and 0.82 for in 1,000 patients per day in 2012. Quality improvements has been used in other industries as well. At first, it's aviation. Passenger safety will come at the first place. As the data show in 2019, there were 20 fatal aviation accidents that occurs and it cost 280 deaths. So it is very important to do the quality improvement and to improve the customer certification, thus achieve the best service quality. Other industries like the manufacturing and education, big data help to analyze and to diagnose process problems. Predictive value to quality assurance to minimize the cost. Go to the education, quality improvements will help to improve the school and the employee to find out the problems to solve the problems, thus achieve the highest quality outcomes.
Hi everyone, I'm Ashmita. I'll be talking about the frameworks and national standards which is applicable to our group's topic of quality improvement in healthcare. I'll be discussing about the Australian Commission on Safety and Equality in Healthcare's frameworks and standards. I'll be covering a bit about the purpose of framework. The Australian Safety and Equality Framework came about in 2010. Its vision was for a safer and higher quality care system so as to achieve optimal outcomes. The framework covers three main components such as consumer centered, driven by information, organized for safety. I'll explain this further in my next slide. This framework acts as a guide for all in the health system to achieve a safer and quality filled organization. The framework creates a simple strategy and system to abide, reinforces, corrects, and creates new ways to improve and standardize practices, allows consumers and healthcare professionals to work together and improve workflows. Now I'll be moving on to the three main components of Australian Commission on Safety and Quality in Healthcare. First would be the consumer centered. It develops methods and models to assist in service provided to patients, have a shared decision making between patients and healthcare professionals. Healthcare system provides a conducive environment for consumers. Second would be the driven by information. Usage of appropriate guidelines to avoid discrepancies of services provided. Learn from patients' experience and improve care. Analyzing and improving current practices to ensure better service provided. Third would be organized of safety. Healthcare professionals and government take appropriate actions for safety. New models are designed and funded based on safety for consumers. Safety being a key component for healthcare professionals, the funding organizations, and government. This will be further explained by Shankari in her presentation. Now I will be discussing on the NSQHS National Standards, Action 1.8 and Action 1.9. 1.8 is to ensure an effective quality improvement system in place in organizations, and Action 1.9 ensures that timely and accurate information on safety and quality improvement is provided to the consumers. NSQH's national standard comprises of 10 main standards. However, Standard 1 is more applicable to our topic on quality improvement in healthcare. Standard 1 is about governance for safety and quality in health service organizations. Now we will be looking at the purpose of national standards. Action 1.8 helps to identify safety, quality, and analyzes outcomes. Analyzes areas for improvement, implement strategies. Consumers and organizations can work together to promote a safer and quality service. Action 1.9 has a following group of people working together to achieve timely, safe, and quality performance. This group comprises of the government, workforce, consumers, local community, and other health service organizations. Next, I will pass on to Shankari to discuss about patient safety and its principles.
Good evening, everyone. My name is Sankari, and I'll be going through with the class on what patient safety is, patient safety principles, as well as some examples on the association of quality improvement to patient safety principles. First, let us take a moment to watch this video on what is patient safety. You can click on the link to watch the video. Okay, that was a good video on patient safety. So let us move on. If you want to watch the video again, you can search for it in YouTube under the Leapfrog group. So what exactly is patient safety? When a nurse or doctor, which is a healthcare worker, shows a behavior to reduce the risk of causing harm to patients and creates ideas or new methods to prevent injuries to patients, this is where patient safety falls in place. So what is quality improvement then? It is the capacity to use appropriate tools to enhance our healthcare system and patient care, which reduces harm to patients and thus increase patient safety. In the next few slides, I'll be sharing with you on some patient safety principles and some examples. So, the Australian Health Ministers have endorsed a safety and quality framework for healthcare in the year 2010. The objective of this framework is to create a safe and high quality of care for our patients. This framework focuses on mainly three core principles. First is consumer-centered, which in other words means client-centered. It is meant for our patients, and this principle is to ensure that we respect and respond to patients' needs and values and improve the system through this. The second principle is driven by information. This means that the healthcare workers use current evidence-based learning which is like our articles or peer reviews or journals to guide our decisions for patient care. The third principle is organized for safety. It means safety comes first at all times in the way that the facilities in the healthcare system runs. So next I'll be talking about some examples to give you a better understanding on how these patient safety principles link with quality improvement. Earlier on, I shared with you on what consumer-centered is. So we are going to focus on area 1.7, minimize risk at handover. This is to prevent the risk of missing out certain essential information during handover from nurse to nurse because of various reasons. One of the quality improvement to minimize risk at handover would be to use SBAR for handover. I'm sure everybody have heard of SBAR. SBAR stands for Situation, Background, Assessment, and Recommendations. By introducing SBAR for handover processes, quality improvement is implemented as SBAR provides us with a skeleton for the handover process. By doing so, the gaps in handing over patient information is decreased, thus improving the healthcare system. Next, we'll be focusing on the second principle, which is driven by information. One of the areas focused in this principle is to encourage and apply evidence-based study that will improve safety and quality. For example, a recent research confirmed that common antihypertensive medications such as ARBs and ACE inhibitors have zero association with a patient's risk of COVID-19 infection, meaning that patients with hypertension can continue their regular medications despite being a COVID suspect or COVID positive patient and be safe at the same time. By applying this research study, care has improved as patient safety is not compromised at the same time as hypertension patients can take their medications as well as receive treatment for COVID-19 at the same time. Last but not least, I'll be talking about the third principle, organized for safety area. The area focused on this principle would be to design and operate facilities, equipment, and work processes for safety. The National Center for Infectious Diseases, otherwise known as NCID, was built as a facility in 2018. This building is designed specially to tackle a pandemic, and it ensures the safety of patients and the community by containing high-risk pathogens during outbreaks in a single area. Hence, it provides safety to patients and improved quality of care in the system preventing harm. I do work at NCID building and I feel very safe to work there as well. So I would say that this is not only safe for patients but also for the nurses as well. These principles and examples are showing how quality improvement has an association to these patient safety principles. Next, I'll pass on to Wang Fei to explain on the nursing role in quality improvement in healthcare.
Hi, I'm Wangfei. Before we discuss the nursing role in quality improvement, let's just take a look of the hospital nurse hierarchy. According to SingHealth Nursing Career Path 2019, nursing team are including Chief Nursing Officer, who is at the top position in nursing, followed by Director of Nursing, Assistant Director of Nursing, then move down are Nurse Management, Nurse Clinician, and Nurse Education. The ground nurse who have more time to contact with patient are Advanced Practice Nurse, Clinical Nurse Specialist, Registered Nurse, Enroll Nurse, and Patient Care Assistant. Nursing management and staff are involved at every level of performance improvement, from unit-based quality action teams to the board of the directors. Senior leadership determines performance improvement activities and priority in the Quality Council. The role of the CNO, Director of Nursing, and Assistant Director of Nursing, they are responsible to set the tone for all levels of nursing staff to participate in quality improvement. Apart from this, they also will communicate strategy goals to all levels of staff for excellence in patient outcome. For the role of nurse management, nurse clinician, and nurse education, they are responsible to communicate and operationalize the QR goals and process to the ground nurse. They also will identify specific errors need to improve and coordinating QI process to improve in unit level. The ground nurse play a very important role in quality improvement as they spend the longest time with the patient compared to other healthcare professionals. They are responsible for early recognition of any adverse events, errors, and complications such as near miss or fall. And based on the adverse events they rise, they will initiate timely and appropriately care to help patient in this situation. According to American Nurse Association, in quality improvement, nurses need to review all related data, evaluate nursing performance, identify errors for improvement, then formulate goals, and improve patient care at the working environment. The safety and quality initiatives of the American Nurses Association focuses on educating nurses about the quality improvement measurement, informing the public and regulating constituents about safe quality healthcare, and investigating research methods and data sources to evaluate the safety and quality of healthcare. Nursing Quality Indicator has been developed by the American Nurses Association, which capture care or outcome most affected by nursing care. Nursing Quality Indicator like fall or injury. Patient fall has been identified as a high-risk indicator that require process improvement after an increase in fall was identified in 1998. Pressure ulcer, infection, mainly healthcare-related infection, like catheter-caused urinary tract infection or wound infections. Safety and restraint. Restraint is a second hospital-wide quality project. Staff satisfaction related to nurse job satisfaction, total hour of nursing care per patient, per shift. staff mix like how many RN, EN, and PCA, and nurse and patient ratio.
Hi, I am Kumaris. I'll be speaking on the supporting website and information on the quality improvement. So in Singapore, the main organization will be Ministry of Health, also known as MOH. The MOH works with other healthcare hospitals to enhance the quality care, hence providing safer care to patients in the hospital. Supporting MOH will be the Agency of Care Effectiveness, also known as ACE, in evaluating the health technology. This ACE will help to review on the drugs, device, and medical services and help to analyze if it's beneficial for the patient. In Singapore, the public hospitals are split into two healthcare groups, the National Health Group (NHG) and SingHealth. Under NHG, Tan Tock Seng Institute of Mental Health, Khoo Teck Puat Hospital, Yishun Community Hospital, Woodlands Health Campus, NHG Polyclinics, National Skin Centre, Admiralty Medical Centre, NHG College, NHG Diagnostics, NHG Pharmacy, Primary Care Academy, Centre for Medical Technologies and Innovation, Johns Hopkins in Singapore. These are the institutions under NHG. NHG uses quality and safety framework for the quality improvement. This framework works as when there is harm or a near miss harm happens to either patients or any healthcare workers, the event is recorded into their system. The event will be monitored for repetitive or if a serious event happens. Then the quality improvement team will then come together to brainstorm and find a solution or an improvement. SingHealth Hospital, Singapore General Hospital, Changi General Hospital, Sengkang General Hospital, KK Women's and Children's Hospital, National Cancer Centre Singapore, National Dental Centre Singapore, National Heart Centre Singapore, National Neuroscience Singapore, Singapore National Eye Centre, SingHealth Community Hospital, and Polyclinic SingHealth are the SingHealth hospitals. So, SingHealth uses the SingHealth NUS Institute for Patient Safety and Quality to ensure on the patient safety and quality improvement. The SingHealth Academy Medicine Enhancing Performance Improvement Care is a framework that combines over 50 staffs from different SingHealth groups to come together to share on their events and brainstorm on the quality improvement. SingHealth also works with other institutions such as the Cross-Institution Infection Control to maintain high level of infection control. They, every quarter of the year, perform an audit to ensure that the standards are met. SingHealth also works with World Health Organization and International Councils of Nurses to ensure patient safety and quality improvement management. Next, we will look into relevance to clinical practice. We will look into how quality improvement is practiced in the clinical area. One example would be the catheter-associated urinary tract infection, also known as COTD. This was the most commonly known healthcare-associated infection causing large amounts of morbidity and mortality rate in 2015. The Quality Improvement Team then came up with guidelines to create and to reduce the infection on the care of catheter. From 2015 to 2016, the guidelines was revisited frequently. The most important points were using the appropriate catheter use, aseptic insertion, use of closed drainage systems, proper maintenance and timely removal of indwelling urinary catheters, as well as the use of established practices such as hand hygiene. In 2016, the urinary catheter workflow was developed as a guideline. This resulted in a COTD rate of 0 over 3 months. Hence, because of their success, they created a workflow to help as a guidance. This is the urinary catheter workflow. It shows when a catheter is needed, when to review and remove, and daily assessment and care of the catheter. It also shows the removal process of catheter, where once you remove, what do you monitor for, and what are the assessments required for a successful removal of catheter. And if it is unsuccessful, what do you do?